Hello, today we are learning Module 1 from Fundamental of Caregiving, third edition. We are on Module 1, Module 11. So this chapter is big, so I divided it into two. The first part is the lesson 1, Nurse Delegation and Self-Directed Care. So today we are learning nurse delegation. What's a nurse delegation? And what's a self-directed care? We are going to cover those two. These are key terms you need to know and understand. Nurse delegation. Nurse delegation is a Washington state law that allows a registered nurse or RN to train a long-term care worker to perform specific healthcare tasks for one client in a certain setting. Without a nurse delegation, a long-term care worker is not allowed to give any medication. Nurse delegation can happen in a client's home, can happen in an assisted living facility, or in adult family homes. To do a nurse delegation, there are some requirements you need to do before. First, you have to be HCA, or you have to be NAC, or you have to be NAR. This has to be fulfilled before you do a nurse delegation. And the second one, after you might be NAR or NAC or HCA, the second thing is you have to take the nurse delegation for nursing assistant in home care aid class training. That's the training that you need to do. And the third one is you should be willing to perform the specific task to be delegated. And the last one is the RN will show you how to correctly perform the specific skill task. Those are the 4 things you need to do. So when you are delegated, the delegated tasks are you take the direction from the delegating RN. The RN will be delegating you, and the RN will supervise the delegation and evaluate the client condition, and then the RN will decide when the nurse delegation begins and ends. And each task for each client is delegated separately. There are what kind of tasks can be delegated and what kind of tasks cannot be delegated. Usually medication administration, non-sterile dressing change, urinary catheterization, using a clean technique, and care for the skin and changing for the wafer around the ostomy, blood glucose monitoring, gastrostomy feeding. If it is in a healed condition, can be delegated. But the stuff that cannot be delegated are injections other than insulin cannot be delegated, or sterile procedures, or maintenance of central IV lines, or anything which requires nursing judgment cannot be delegated. So your role in a nursing delegation is you have a very important role in the care and well-being of clients. So once you are taught a delegated task for a specific client, you are responsible for 5 primary tasks. So you need to watch those. First, you need to perform the delegated task according to the specific instruction of the RN. The instructions should be written somewhere so you can refer back to them as needed. The RN always give you the direction and everything that you need to know, and they put it in paper. You may be required to document that you completed the task. And the second one is you need to observe the client for changes, which may indicate it might be a potential side effect or negative reaction to procedures or complication from a client disease. And the third one is reporting changes in client condition. If you work in a facility or for a home care agent, you need to report to the delegating RN and your supervisor according to the policy. Individual providers report to the delegating RN and the case manager. The fourth one is a report to the delegating RN any changes to the delegated medication or treatment or medication change. On the third one, you report on a client condition change. The fourth one, you report on the medication. Sometimes the medication need to change or need to be stopped, or a new medication can be started. That's the time you report. And the fifth one is you need to renew your registration on time. Usually it's every year. Now we finished about what the nurse delegation mean. And nurse delegation and assisted living and home care are different. When you go to the home, when you are helping a client in their home, it's different. It's called self-directed care. A Washington state law protects the rights of a client living in their own home to direct a paid personal aid, to perform health care tasks the client cannot physically do. So anyone who is living in their home, they can hire a person to do a caregiving for them. Those are the one we're talking about. So these are healthcare tasks that the caregiver would not do otherwise allowed to do so. So like nurse delegation, whatever you need to do, a nurse delegated from the RN, but when it comes to the home, it's different. It's the client who's telling you what to do. Self-directing the healthcare task gives a client the freedom to direct and supervise their own care. That's why the Washington law allows them to do it without the nurse delegation. Self-directed care only applies to clients who employ a paid personal aid, such as IP. They're called IP, individual providers. Agency providers, residents of other family homes or assisted living facilities or enhanced service facilities are not allowed to participate in self-directed care. Self-directed care only works in individual homes. If the personal aid is an individual provider, any tasks that a client wants to self-direct must be listed in a DCHS care plan. So the people that live by their own, even if they live by their own, they have a DCHS case manager and they have a care plan. So the case manager prepares a care plan for them. So you guys, you can read what you have to do, and the person will also direct you, will tell you what to do. The case manager must be involved, and the DCHS care plan need to be updated to include the task before it can be done. So this task always need to be updated. So the roles in the self-care, in the self-directed care are different. Client responsibility, the client one is informs their healthcare provider the task will be self-directed to the caregiver. So these people will tell the case manager, these are the tasks that my caregiver wants me to do. And then they also inform the case manager their desire to self-direct certain tasks and providing the necessary information that must be documented in this care plan. So this person will tell the caregiver what to do, and this person will tell the case manager, these are the things I want. So my caregiver wants help me. He will tell the case manager. So training, directing, and supervising the personal aid in performing the task. This is the client responsibilities. Client have to tell the case manager, these are the things I want to do. Client is the one who's directing and supervising everything. Client is the one. And what are the responsibilities for personal aid? What are the responsibilities? The first is the caregiver has to decide if they are comfortable providing the self-directed care task. The caregiver, are they comfortable? Second, the caregiver or the trained person has to do the task right, and they need to do the task according to the instruction from the client. This is the personal aid responsibilities. And the case manager responsibilities, you need to document the self-care tasks in a DCHS care plan. There's a DCHS care plan, the case manager needs to document that, and including what is to be done and who's doing it. And also the case manager, he does is he gives a copy of the DCHS care plan with a self-directed care task listed to the client, so that when the personal aid comes, they will read it. And the case manager also updates DCHS care plan. It will update it. I think today these are the classes we did. What's the nurse delegation, and what are the self-directed roles. These are the two things you need to know. If you work in an adult family home, you need a nurse delegation. If you work in a home, you don't need nurse delegation, but it's a self-directed care. So you need to follow those things. You need to listen to the client, how he wants the stuff to be done. Thank you very much.